Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Shortages of potentially life-saving anti-infective drugs in the U.S. may put patients at risk or even present a public health emergency, according to a review article published online ahead of print in Clinical Infectious Diseases. Here is some information on anti-infective drugs. They are drugs that fight infection from bacteria, viruses, funguses, and other disease-causing germs. Each anti-infective drug is effective only for a small range of certain types of germs. When a particular anti-infective drug is not available, there may not be other drugs that are as effective against the same germs. Researchers from Midwestern University and Northwestern Memorial Hospital in Chicago reviewed the scope of recent shortages in anti-infective drugs in the U.S. They also discussed why such shortages come about and offered strategies for minimizing such shortages and their negative impact on public health. According to the authors, of the 193 medications that were in short supply in the U.S. at the same time of their evaluation, 13 were anti-infectives. Shortages in the most effective medication for such serious conditions as herpes encephalitis, syphilis, TB, and serious bacterial infections have all occurred in the U.S. This forces patients to use alternative drugs, which may be less effective. While the causes of shortages remain unclear, they can be the result of problems with procuring raw materials, processing, distributing, regulatory compliance, market shortages due to epidemics, new therapeutic indications, and perceived shortages. The investigators recommended the development of multidisciplinary stewardship programs to help clinicians choose and use alternative anti-infectives appropriately when necessary. They also recommended that hospitals develop strategies to both predict shortages and to minimize their impact. Finally, they recommended changes in legislation that would allow the Food and Drug Administration to identify and correct shortages in life-saving anti-infectives. Today's review highlights the problems of shortages in anti-infective drugs that occur in the developed world. For Insider Medicine in Depth, I'm Dr. Susan Sharma.